Injuries of the spine. Back injuries are quite common, and their severity varies greatly depending on the nature of the injury and the tissues affected. The most common types of back injuries occur to the intervertebral discs, vertebrae, bones, and soft tissues such as muscle, tendons, and ligaments. Degeneration of the intervertebral disc. Degeneration of the intervertebral discs normally results from chronic loading of the tissues over time. Loading includes amount of force exerted, and the duration and frequency of time spent in awkward postures. Disc degeneration results from the wearing down of the intervertebral disc due to the nucleus within the disc exerted pressure against the annular fibers. The stages of degeneration include movement of the nucleus within the disc. The annular fibers become brittle and lose strength. The nucleus inside the disc exerting pressure on the annular fibers, which then over time causing it to expand into the spinal canal. The nucleus then exerts pressure onto the spinal nerves. Stages of intervertebral disc degeneration. The first stage of degeneration is disc protrusion. Ongoing lifting, twisting, or bending movements in addition to weights lifted causes discs to wear out over time, years of exposure. As the annular fibers weaken due to internal pressure and becomes less able to absorb shock, the nucleus material presses against the annular fibers which begin to break or tear. Over time, the pressure within the disc tears enough of the annular fibers to result in the formation of a bulge which then exerts pressure on the spinal nerves. The fluid inside the disc stretches the fibers but does not penetrate them. The second stage is disc extrusion or herniation, also known as slipped or ruptured disc. Tears of the annular fibers typically occur at the rear of the disc. The nucleus is expelled into the area of the weak fibers. This creates a partial protrusion into the vertebral canal. The third stage of degeneration is disc sequestration. In this case, a piece of the disc breaks off as a fragment that might still be loosely attached to the original herniation, or it might be a free-floating fragment which then applies pressure on the spinal cord, which can result in severe pain and injury. Degenerative disc disease is a broad and general term used to describe the changes to the bones of the spine, not specifically the discs. Despite its name, this condition isn't actually a disease. DDD starts with changes of the vertebrae, bones, that eventually can affect the discs. The term DDD is not consistently defined within scientific literature or used consistently across different professions. Often referred to as age-related since every part of the body changes as we age. However, how can a 40-year-old with severe DDD based on X-rays be labeled as having age-related changes when that is what one would expect to see in an 80 to 90-year-old? The reason is that there is no set standard or criteria in place that indicates what level of changes would be expected at a specific age. Diagnosis of DDD is typically done using X-rays. However, X-rays are limited to detecting changes to the bones and not soft tissues, such as the discs and muscles. In addition, there is no universal set of criteria to diagnose DDD. The term DDD can be used for any change ranging from minimal degenerative changes to extensive damage. Without a clear set of diagnostic criteria, the diagnosis of DDD will continue to be a controversial topic. The difference between a herniated disc and DDD is in the origin of the problem. A herniated disc occurs due to a rupture or displacement of disc material, whereas degenerative disc disease arises from the gradual wearing down of the bones and loss of moisture from within the disc over time. Not everyone with a diagnosis of DDD will experience pain. It often depends on the degree of degeneration, type of condition, and if there is damage to the discs. In many cases, after a person has suffered an injury, X-rays will often be taken. If an abnormality is observed, this will often become the focus for a possible compensation claim when it may not actually be the actual cause of the person's pain. There are 4 stages of degenerative disc disease. The first stage is called dysfunction. This is often painless with only subtle changes in the curvature of the spine that can place added stress on the spinal nerves and hastening the degenerative process. The second stage is called dehydration or disc desiccation. Here the spinal discs begin to lose their moisture content, causing them to become less effective at absorbing shocks and supporting the spine. The loss of hydration can lead to increased pain and stiffness. There are little or no spinal changes to the bony structures of the spine in this stage. Results in fibrocartilage replacing the nucleus fluid within the disc. The third stage is known as stabilization. Postural changes are more pronounced and visible. Often the formation of hard bumps of extra bone called bone spurs will begin to form on the end of bones. These develop as the spine attempts to create a more secure spinal base. As these spurs grow, mobility of the back can become limited. As the body tries to restabilize, the space inside the spine can narrow, placing excess pressure on the spinal cord and the nerves traveling through the spine. The fourth stage is known as collapsing. Here the discs become very thin with minimal disc material remaining. Severe bony changes of the spine may be present. The bones will often fuse together to compensate for the lack of cushioning between them. Conditions of the spine that are often classified as DDD include osteoarthritis, spondylosis, bone spurs, ankylosing spondylitis, inflammatory disease that can cause vertebrae to fuse, spondylolysis, tiny cracks in bone, spondylolisthesis, vertebral slippage, and osteoporosis. Soft tissue injuries are often referred to as mechanical back pain and affects muscles, ligaments, and tendons. Muscles are stretchy, fibrous tissue that allowing the body to move and maintain different positions. Muscles are connected to bones and joints by tendons. Tendons are tough fibrous collagen tissue that attach muscles to bones. Ligaments are slightly elastic fibrous tissues connect two or more bones together. Ligaments also help to stabilize joints and prevent excessive movement such as hyperextension and hyperflexion. Ligament strain or tear. Ligaments connect bones to provide stability of the joints. When a joint is destabilized, a ligament may become stretched beyond its normal capacity, usually resulting in a tear of the ligamentous fibers, known as a sprain. Sprains vary in severity from mild to severe. Mild sprains are where only a few ligament fibers are overstretched or torn, grade 1. Severe sprains are where the entire ligament tears into two separate pieces, grade 3. A ligament sprain or tear usually occurs via sudden trauma but may also occur due to overuse, continued stress placed on tissues with inadequate recovery. Muscle and tendon strain or tear. Muscles are contractile tissues that shorten to produce movement within the body and are attached to bones by tendons. Most muscles cross at least one joint and are attached to the articulating or moving bones that form that joint. Muscles produce movement or stabilization by exerting force on its tendon, which in turn pulls on its attachment, bone. Muscle strain or a pulled muscle is an overstretching or tearing of muscle fibers. Strains can occur in either the muscle itself or in the tendon attached to the muscle. Severity varies from mild, few muscle fibers are stretched or torn, to severe, entire muscle tears into two separate pieces or tears away from its tendon. A muscle strain or tear may occur through sudden trauma or overuse, continued stress placed on tissues with inadequate recovery. For additional information visit www.hocow.on.ca.